Welcome to Rural Health Today. I'm JJ Hodshire, President and Chief Executive Officer of Hillsdale Hospital, and this is a podcast where we connect you, the listener, to what really matters the most in rural health. Today, I'm excited to welcome to the show Travis Robey, Vice President of Political Affairs. Wow, political affairs. We'll talk about that in just a minute. For one of my favorite organizations, the American Hospital Association. And so, Travis, this is your first time, I believe, formally on our podcast, and it is such a pleasure to have an expert like you in the studio with me today. And so I want to welcome you, first of all, to the podcast. And to our listeners that are listening, let's just give them a little bit background about who you are, what you do each and every day in your job, and what brought you to the organization to really be an expert in your field. And then a secondary question we'll get to in a minute is what your organization is and does. But first, I want to start with you. Why don't you give our listeners a little bit of background?
Well, first, thanks so much for having me. I was born and raised in Coldwater, Michigan.
Get out
so
of
about
here.
35, yeah, absolutely, 35 miles from Hillsdale, obviously, as you know, JJ,
Absolutely.
but most of your listeners probably won't. So I've been very excited about our conversation, and I talked to my mother-in-law, who's a retired nurse from Coldwater Community Hospital.
Oh, wow, that's incredible.
So she and her nurse friends are certainly going to give you a boost in your listeners.
Good, that's
for
fantastic.
This podcast, and I'll try to do right by them by giving some good rural health.
I'm sure you will, Travis,
as we go.
Well, let's dive a little bit into that, because then you're rural. You came from rural.
Absolutely.
Okay,
yeah,
so you know the intrinsic value of rural health, but now you're at this massive organization that has a wide scope, quite a bit of autonomy in authority, working very closely with our legislative body and other things that you do. But you know the value proposition with rural hospitals today, and I really want to hone in on that. But prior to going to the AHA, where were you? What's your background? What'd you do?
I was on Capitol Hill for almost a decade. I've been at AHA for just over 11 years. Actually, earlier this week was my 11-year anniversary at AHA. And as you know, I get rural health. I grew up in rural Michigan. I've always had a passion for healthcare policy and politics. So I went to law school to focus on healthcare policy and wanted to work on Capitol Hill covering healthcare issues. So I was very fortunate that, for nearly a decade, I worked for two members of the Ways and Means Committee, which, as your listeners probably know, has jurisdiction over the Medicare program, over taxes. And then I had an opportunity to join the AHA when I left the Hill. And I left with that chance to keep working on the important issues that the hospital field's facing every day, affordability, sustainability for providers, improving quality and access. So it was a natural fit, and started working on rural healthcare issues, or taking the lead, I should say, on rural healthcare issues at AHA, 5 years ago or so. And I was excited to take on that portfolio. All the members I worked for on Capitol Hill were from rural districts. So excited to be able to get to working on these issues that mean a lot to my community, my family, where I came from.
Absolutely. And I'm excited to talk to you about all those things. And we're going to jump into it here in just a minute, because with your background, as diverse as it is, and having worked in Washington and still involved in Washington, there's a lot of things happening that, in Washington right now that impact the day-to-day lives of rural Americans. And as it, relates to healthcare, there's been a lot of changes in our environment over the last even 6 months to a year. So we'll dive into that in just a minute. But for our listeners, to humanize this, just one more opportunity. And maybe you already gave me your interesting fact or a fun fact about you. Maybe it was the Coldwater fact. And I just, to humanize this with our listeners, do you have a fun fact about yourself? I mean, anything that you want to share with our listeners to make you more of a real, a presenter today?
Well, yeah, as you just, I used up my fact earlier. That was poor planning on my part. I should have held back apparently on that. But just to show you a little bit more of my rural street cred, my first job was corn detasseling and roguing. And obviously, JJ, you know
I did
cold
it.
water.
I did it.
I love it. I love it. It's hard work, man. It is hard work to be in 90 degrees in July and in the cornfield. That's like a sauna.
Oh my goodness.
As you
no
know.
kidding.
So, and for the rest of your listeners who don't know Branch and Hillsdale counties as well as we do, my father grew up in Coldwater as well, and he actually went to a one-room schoolhouse from first grade until he started high school. So it's rural America.
And those schoolhouses still exist. They're still around. They're some are turned into houses, but I certainly remember as a young boy. I think I started when I was 13 under a CETA program. It was called. It was for poor families, and you were bused to cornfields. Swear to goodness, and we detasseled all day corn. You packed your lunch, and it was you couldn't get any more rural than that. Let's just say that it was pretty incredible.
Absolutely.
Well, it's great to have you and your perspective here with us today. I'm excited to jump in and discuss about so many things, but every day there's a new alarming headline for healthcare. There's very rarely that I wake up and say, wow, that's encouraging for healthcare. In this episode, we'll explore the most pressing and lasting issues in governmental affairs for healthcare. We'll talk about how the failure to extend enhanced premium tax credits is impacting reimbursement and what to expect to see in the rural health legislation for 2026. And of course, what all of this has to do with rural health. So first of all, Travis, tell us a little bit about the American Hospital Association. I mean, when we say the AHA, it really brings to mind a team of dedicated professionals like yourself, Juris Doctorate, PhDs, MDs, you name it. You have a wide spectrum of individuals that are working in the environment of helping sustain healthcare, not just rural. I mean, there is a component of rural, which we appreciate, but healthcare in America. And your leader is someone who just recently announced his retirement. And your leader is someone who has spent decades on Capitol Hill and decades really advocating for hospitals across the country. So to give our listeners a little better perspective about what is the AHA, what do you do, what's the purpose of the AHA, and what does the membership look like?
The AHA, as you said, a great organization. I've got tremendous colleagues I'm incredibly fortunate to work with. And it's all because we have a mission-driven purpose, like so many in the healthcare space who are delivering care at the bedside. AHA's mission is to advance the health of all individuals and communities, and we represent and serve hospitals and healthcare systems that are accountable to the communities that they serve and committed to providing quality healthcare every day to patients in their communities, particularly on the rural side, who are their neighbors. So it means so much because these are folks that you're seeing at the grocery store and around town. And we do that on behalf of our nearly 5,000 members, so that way we can speak as a field with a unified voice on Capitol Hill and with the administration through lobbying, grassroots advocacy, media, legal strategies, kind of the full spectrum of our advocacy toolbox to make sure that we bring the interests of hospitals and health systems and the patients that you all serve to the forefront.
Yeah, and I just wrote my check for my dues. So when I write that check...
Thank you very much.
Absolutely. When I write that check, I know what comes behind it in the resources that we get. But for someone listening today, and better perspective even for those who may not have joined AHA and are considering it, the value added. You want to talk about the value proposition, because it's not just that we belong to an association, but it's what the association does. You have webinars, you have trainings, you have conferences, but you have lobbying efforts. Can you talk a little bit about some of the tentacles of AHA?
No, absolutely. We have, as you kind of alluded to, there's a sort of spectrum of our advocacy work. Of course, I'm on the federal relations, the lobbying team, going up, talking to legislators and staffers every day. But then we've got policy colleagues who are working with the administration and delve more deeply into the policy details on these issues. And that includes my colleagues who work on data issues and get us the trove of data that we use to tell the hospital story both on Capitol Hill, but also to the press. We have a great communications team where we're always out trying to tell the hospital story to make sure that your voice in the hospital community is heard. I mentioned legal issues, but obviously we've had a variety of successful lawsuits where we need to make sure we're protecting the hospital field's interests. And of course, we also have a team of folks who work on trying to get more into the nuts and bolts of improving healthcare in the field and sort of doing the research and study on that side of things through HRET as well. So it really is the full gamut of issues to make sure that we can best advance the interests of hospitals, health systems, and again, at the end of the day, most importantly, patients and communities.
Yeah, absolutely. And really to allow our listeners to know a little bit more, I serve on the Michigan Hospital Association Board of Trustees. My president, Brian Peters, is on the AHA board, and we've actually joined in many efforts, most recently even to file on behalf of Michigan and hospitals for such things as 340B and in concerning areas of tax rollbacks for the tax credits. So certainly the advocacy goes so deep, and it is a lot of work. You spend a lot of time in lobbying efforts, which is the value added back to hospitals like mine, because I can't be there. We're running the day-to-day operations of a hospital. Many my size of rural hospitals, we're COOs, CEOs, sometimes even CFOs all in one, working, and we need the expertise of Travis and other leaders. So it's great to have you up there representing us. I want to thank you for that first and foremost, because we've had a lot of victories. We can't underscore those victories with all the bad news. So I want to just be able to highlight that in the last year, you have come to very difficult situations in which you've really mitigated some very challenging times for hospitals like mine, and you've been very successful. And so I want to thank you for the work that you've done in that area. Second of all, as we think about those pressing issues that we're facing in this country right now as it relates to healthcare, I really want to pick your brain a little bit in the area of what you see right now as some of the most challenging issues that we're facing right now in pressing issues in policy development. And what would you say if you were to prioritize? What are those one or two things that right now are keeping you up at night that you're really focused on? And I guess the secondary question to that is, once you identify what those are, what should we hospital leaders be watching for?
First, I guess maybe what I can start with is Capitol Hill's perspective, and that'll tell a little bit of what we're focused on, but also then I'll talk about some AHA hospital field priorities as well. And from the Capitol Hill perspective, it's really about affordability right now. That's what legislators are talking about, and frankly, that's what patients and voters are focused on as well. President Trump ran on affordability in 2024, and Democrats won big in the off-year elections last November with a focus on affordability. And as we've headed into 2026, Republican leadership have made clear, both on the House and Senate side, that they're going to focus on this issue throughout the new year and the run-up to the election. And they try to recapture some of the political momentum they had back in 2024 and early 2025. So affordability is very much going to be the lens through which any legislation and all of the issues discussed in congressional hearings are going to be viewed through, over the course of the next, 10 months as we head into to election season. And obviously that's important to AHA too, the affordability piece, and that's something we're concerned about. But we're also focused, particularly from the rural perspective, on sustainability for hospitals and health systems. And that's, of course, particularly important for safety net hospitals, for rural hospitals. At a time of sharply divided politics, it means that we need to continue to support a lot of the critical role programs that help keep the doors open at rural hospitals, help maintain access to communities, and make the financing work for hospitals. And so we won't go through the full litany of those, but of course, your listeners are going to know that's telehealth. That's things like the low volume adjustment, Medicare dependent hospital program, extending Conrad 30, extending the Medicaid dish cut moratorium, the rural physician gypsy floor. All of those things are critical to be able to continue to make sure that Capitol Hill understands the importance of all of those programs. And then we need to continue to build on that consensus to continue strengthening rural health care, because we're still struggling with rural hospital closures, with challenges with rural hospital financing. So the status quo isn't enough. We need to do more. And fortunately, I think rural health is an area where there has been ability to achieve some bipartisan consensus in recent years, despite the bad political tone that we've had on Capitol Hill in recent months and years. But again, rural health has consistently been an issue over the years where we've found some consensus. And so we're hopeful that we can continue to do that.
Yeah, great perspective. I had my good friend and colleague on this podcast a few weeks ago, Scott Becker from Becker's Healthcare, and Scott was sharing with us. He has a tremendous team of really dedicated researchers that are always searching for news as it relates to healthcare. And one of the areas of focus for Scott has been having his team dive into hospital closures. And, we know since 2010, over 160 hospitals in this country have closed. Majority of those hospitals are all rural hospitals. But what was even more alarming is that with the passage of the One Big Beautiful Bill, as a result of that, some of the work that has been done by these folks demonstrate that 800 plus hospitals are at risk of closing in this country by 2032, when this legislation really is, vetted full force and effect. And so it's very concerning. And when we talk about, as you just did, LVA, someone might say, what is LVA? Low volume adjustment. The price tag for Hillsdale Hospital for the revenue enhancement on that's $300,000. One might say, well, that's nothing. For a big system, that's probably what they spend in paper clips. For Hillsdale, that's operations. When we talk about making $30,000 a month, you annualize that out. That's our annual revenue. And so when you look at it from a perspective of what these programs mean, and then you start diving in a little bit deeper, 340B. 340B has a significant impact on hospitals that are rural like mine. For me, it's today it's $700,000, but we're growing it. So just two programs that could easily go away would be $1 million right from my bottom line, on top of the average commercial rate, which goes away by 27 under the One Big Beautiful Bill, which strips from me $6 million annually from my bottom line. These decisions that are being made in Washington have far-reaching impact in communities like Hillsdale, to the point where closures are being discussed more frequently than any other conversation, whether it's mergers, acquisitions. It's really coming around closures. You cannot sustain the environment that we're in right now due to the high Medicaid population in rural communities without the proper reimbursement necessary to fund the operations. And that becomes a significant challenge. And the HA is really on task with being the voice for rural hospitals in Washington. There's been some legislation recently, Travis, and while Congress has gutted Medicaid and what we would say is the uplifts that we've received under, the provider tax, we also recognize, while that was done at the same time, the Congress has not extended the tax credits. And those tax credits are very important. I had one provider here that was sharing with me his premium went, and he's an independent contractor. His premium went from $1,500 a month to $4,000 a month, family of five. And he can afford to pay that. He doesn't like it, and it's going to impact their spending habits. But in communities like mine, where the average household income is $50,000 for a family of four, and you know that, having grown up in Branch County, we're very poor, we're very rural, that a 300% increase in your premiums means you're not going to pay your premiums. You can't afford it, which means we're going to have higher levels of uncompensated care, which means we're going to have higher numbers of individuals showing up in our emergency departments and no place for them to be. And at the same time, government's cutting additional and additional. So let's dive into one of those areas. I know that was a lot, but let's dive into one of those areas. And most recently, the failure to pass the enhanced premium tax credits. What does this mean from your perspective? What does this mean for patients? What does it mean for hospitals? And are we seeing the impact already? What are you hearing across the country?
Well, the data shows that you got 22 million people are going to face higher costs without the enhanced premium tax credits. And we'll call it the EPTCs for the rest of the time. I hate to use too many acronyms, but I imagine most of your listeners are following this closely. But the EPTCs, and it's going to have a disproportionate impact on rural communities. 36% increase in uninsured individuals is what we're talking about for rural communities. That's a significant impact, particularly when you add in, as you already mentioned earlier, the disproportionately high numbers of Medicare and Medicaid populations in those communities. So it is so important to have the private insurance and from a reimbursement perspective. And the loss of that coverage is going to put a lot of financial stress on hospitals and health systems as you face more uncompensated care and bad debt. And so as a result, if the EPTCs do not get extended, obviously as of now they've expired, but we can talk more about where things stand going forward. But the analysis that we have done shows that the hospitals will face a $28 billion reduction in spending over the next 10 years.
Unbelievable.
And so it's a huge impact.
Not sustainable.
Yeah, absolutely. And CBO projects that you got 4 million marketplace enrollees are going to become uninsured. And a lot of other people will become less well insured as we move forward on this. So we're talking about a very substantial impact, both on hospitals and on patients. And that means on the communities that rural and all hospitals serve. It's going to impact everyone. We're going to see longer wait times, more overcrowding as people begin to use the emergency department. And when you look at all of the financial strain that the field is under, it can also add to the prospect that you may see, service lines closed at certain places, and people looking at, as you talked about earlier, making tough decisions about what you need to do for providing those services in your community. And no hospital leader, no healthcare provider wants to do that. But that's the concern as we see these impacts sort of increase over the coming years as the full scope of the reconciliation cuts go into effect.
So let's talk about that because, we're going to promote this podcast ahead of a lot of the others we've pre-recorded simply because of the timing. It's very important to talk about this. But right now we're hearing, I've received some communication from MHA, AHA, talking about the potential bipartisan support for restoring these. And you're the expert. You're there on Capitol Hill all the time. Is this a reality? Is this a falsehood? Do we have hope in this? What, from your perspective, and I know you there's no guarantees here, but from what you're working from your perspective, is there hope for some of this to be restored?
I do think there's hope. I think there are a lot of hurdles between now and January 30th when the government funding deadline goes into effect, and that's the kind of the target to hopefully get something done on this. But time is short. As this goes to publication, there'll already have been a vote in the House of Representatives to pass a 3-year clean extension of the enhanced premium tax credits. That's going to be within hours of when we're sitting here today. Now, that's not going to get a vote as the standalone measure in the Senate, but it has helped spur along the bipartisan conversations that you talked about. And, there have been sort of an uptick in those conversations, both, with senators on both sides of the aisle and House members coming over to the Senate side to have these conversations about how can we come to a package, how can we come to a resolution on something that addresses this issue for hopefully at least the next couple years, if not beyond. So I think there's still a lot of hurdles to be able to get over that. Hopefully the president will engage on this issue and help bring everybody together. I know that's going to be a key part of any ultimately successful package. But we've got the pieces at least in place of conversations that are ongoing.
Travis, can you give us a sense of from your perspective, will the president, from the folks you're talking with around him, will he support? Do you think he'll support some of these restorations to this, or is this something that's going to really be caught up in this political firestorm of purely politics and partisan politics, or do you see that there's going to be some direction from the executive branch?
That's our hope. I think it's hard to say right now whether there's something that the president, as well as House and Senate Republicans, can agree on with Democrats in the House and the Senate. But again, I think it's positive that there's these ongoing conversations, and we'll have to see how everything plays out. But needless to say, in order to get something over the finish line, the president's going to have to sign it into law, and likely to get significant Republican support on either side of the aisle. They're going to want to see the president, engage on the issue and rally behind a specific policy. So I think we're hopeful that we can get there. But again, a lot of barriers and a lot of hurdles, maybe is the better way to say it, to overcome between now and a successful resolution on this issue. And again, really targeting January 30th when government funding expires to try to come to a resolution on this issue. What I'll say is there's been no time over the last 4 or 5 months where there have been more serious bipartisan conversations on this issue, and that's a positive development.
And so let's talk about the deadline of January. If we do not have continuing resolution, could we? Are we talking about another government shutdown? What do we have to expect?
I think it's highly unlikely there's going to be another government shutdown. I think Democrats have made quite clear that they don't have an interest in a shutdown. There have been a lot of positive conversations with Senate appropriators. They've agreed to sort of top line budget numbers. They just rolled out a couple days ago what's called a minibus, sort of a package of several bills that they're going to try to move forward here. And then they're working on the rest of the appropriations bills to get those over the finish line. So I think there's real positive momentum to come to a spending package agreement before the 30th. And hopefully that momentum sort of carries over into the enhanced premium tax credits. And one, gives some breathing room for leadership to be able to come to an agreement on that. And again, create some momentum that, hey, we've been able to agree on something else that tripped us up in the fall, leading to the longest government shutdown in U.S. history. And hopefully we can overcome the EPTC issue as well.
Travis, this is extremely encouraging because I certainly thought that, we may be headed in another direction. I'm encouraged to hear you say these things, that we could have some positive resolution here. So I'm going to hold you to that. And maybe, if you're right, I'll buy you a nice meal in Coldwater, Michigan. Nice little golf course there that has a restaurant. I'll make sure I take care of you there. And I'm very hopeful for our listeners that, that your assessment, because you are truly the expert, is accurate, because there's too much to lose in these conversations. And when I say that, the losses will be of life, because when hospitals close, we know that for strokes and other major incidents, time is tissue. And if you can't get that patient to the nearest hospital, because that hospital is an hour away, and then you lack ambulance transport and you lack all the resources necessary because of all the cuts that have occurred in Medicaid and other programs that shut down vital services, this is a matter of life and death. And we oftentimes forget about that. It's not just politics. What we're dealing with is some of the most fundamental, important things to living, and that's our healthcare. So thank you for obviously being a voice for us in Washington to advocate. And speaking of a couple other issues that I want to tackle before we have to conclude today, is there's been a lot of discussion, from the administration right now about H-1Bs and the visa challenge that hospitals are facing. And CEOs are listening across the country to this podcast, and they often email us and ask us questions about what we're hearing. And that's why we decided we wanted to bring the expert here. What are you hearing in Washington in terms of how that's influencing and impacting our healthcare workforce? Because the talent pipeline is very difficult right now in healthcare. As you know, there's a provider shortage across this country. We're dealing with nurse shortages, provider shortages, ambulance shortages, you name it. We're facing it. And then we complicate this with legislation that will restrict the ability for hospitals to retain or to recruit top talent because of these restrictions. So can you talk to us about where we're at with that? What are you seeing? What are you hearing? And what do you anticipate the permanent impact might be?
Well, we've done a lot of outreach to the hospital field to understand what their experience has been with the H-1B visa, the fees, and some of the other changes that the administration has been proposing. And as you know, there are provider shortages across the healthcare field, but felt no more acutely anywhere else than in rural communities. So something that we know is so important for rural healthcare. And what we've heard in that outreach throughout the end of 2025 is that a lot of hospitals have paused pursuing hiring of clinicians who need an H-1B visa, and obviously that's a concern. Particularly because a disproportionate number of H-1B visa holders practice in rural areas. So this has an outsized influence on rural access to care and the pipeline of providers that are so important to keep ensuring access in rural communities.
That's right.
I guess what I'll say is that we do believe that we haven't exhausted all of our advocacy avenues here. We're taking feedback from the field and are going to continue to engage with the Hilton administration on this issue. We have asked for a blanket waiver for healthcare providers and are going to continue pursuing that option. Obviously, the proclamation has moved forward, and that's why we've seen the adverse impact. But we're hoping that it won't be a permanent impact because we still feel like we've got some avenues left to pursue some changes on this front. And on a bipartisan basis, we have legislators that we've been working with who share those concerns and have been trying to work in a constructive bipartisan way with the administration to share that the healthcare field, given the acute staffing needs, particularly in rural communities, this just isn't a workable option, particularly for if you're any rural hospital itself, particularly if you're a small independent. It's very difficult to think about a $100,000 fee and being able to move forward with that.
In most communities, Travis, that's the profitability margin of hospitals for a year. Annually, we're talking about taking, and if you have 3 or 4 of those providers, multiply that times 3 or 4. It is not sustainable, and so I'm very hopeful that the work that you do in advocacy will help promote a reduction of those fees or elimination of those fees. But it's something certainly I know you're going to keep an eye on into 2026. The last area that I want to focus on, and it's hard to believe time is it's escaping us. So the One Big Beautiful Bill comes together. We start hearing about it March, April. Really didn't think that it was going to materialize into what it did. A lot of folks were saying, no, there's no way we're going to gut, healthcare to that degree, and it happened. And it happened at such a measure that $1 trillion, was cut from healthcare and programs that are critical in communities like Hillsdale and other rural communities where Medicaid and Medicare represent 70, 80% of the population. Medicaid represents 70% of our OB population. It represents 30 to 40% of our general population. And when those cuts come at the degree that they did, the total number and impact to this industry is $1 trillion. And with that, it was hard to even comprehend how are we going to make it as an industry with these rollbacks and all the requirements. And we're still having those conversations in boardrooms across the country. Hospital CEOs are meeting with their boards talking about what programs are we going to shutter? What services are we going to divest? And what services do the community want, need, and what can we afford to keep open? And I don't see those conversations going away in 26. I see them intensifying. I see other hospitals saying, we're going to affiliate, we're going to sell, or we're going to close altogether. Just this morning, I received a note from Scott Becker saying that another Kansas hospital shutter services overnight. You hear these stories day in and day out. And the reason I set this question up is because we know the impact of this one big, beautiful bill is devastating to rural hospitals by taking away the uplift in the payments that we received to serve the Medicaid population at a reimbursement rate that covers the cost. We're not even talking about a huge margin. We're talking about just covers the cost of the population. So to combat that, Congress comes up with this idea, and I'll leave my personal opinion alone, but they come up with this idea to create a rural health transformation fund. And that fund was going to, it's talking points of congressional leaders across the country who are saying, well, hospitals are not going to have it so bad. They've got this federal funding that's a pass-through to each state. Each state gets to determine what program areas. They submitted their application, and just last week or the week before, CMS announced the award winners. Michigan, by the way, was 43rd on that list. We're at the 7 of the states that are at the lowest bottom for the total number of dollars received. In our state, Michigan Department of Health and Human Services were selected to run the program. They're creating a bureaucracy with a new department of 30 people, and you have to go through a very regimented process, application process. It's going to be very competitive, and they did not take one recommendation from my committee at the Michigan Health Hospital Association. We had a task force that really put together a recommendation to MHHS about what our rural hospitals must need in the future years. None of that was accepted. That'll be for another program. But for the purpose of this conversation today, what are you hearing about the RHT funds, so the Rural Health Transformation Funds? And can you share some insight into how the funds are being distributed? What are you hearing from other states? Is there a lot of momentum? What do we expect?
Well, so as you alluded to, every state is different because there were 50 state applications, and every state did get some amount of money. So it varies pretty significantly from state to state. But first and foremost, we and I know all of our state association partners believe that first it was very clear that Congress intended for the Rural Health Transformation Fund to help rural hospitals, and that's what the money was. It was intended to do, and that's what it should do.
I agree.
Going forward, and it's about protecting and promoting the sustainability of rural healthcare services and access to care in rural communities. I think there can be interesting things done to promote innovation, but you can't focus on innovation to the detriment of sustainability, because we already talked about the financial challenges facing the field, but 40% of rural hospitals operated at a financial loss in 2023. We've had over 100 closures or conversions in the last decade. And so we're going to continue to talk about the need to protect rural access to care. We advocated for things like direct payments to hospitals to support their operations, supporting workforce training and recruitment and retention in rural communities, investing in infrastructure and telehealth. Those are the things that should be prioritized to make sure that yes, there are things that we can do and must do to promote innovation in rural communities, but first and foremost, so many rural communities are struggling to just maintain access to care, and we can't overlook that. And we believe that's what Congress intended. So, right now, the administration, it was December 30th that they announced the funding. At that point, they released kind of the abstracts of all of the state proposals, and we have been collecting in collaboration with our state association partners, kind of all of the applications. And we're working with them, communicating with those state associations to sort of figure out, okay, now that the states have their funding amounts, what does that mean in terms of where they're going to prioritize their funding? and, sort of partner with them to try to make sure that the message continues to be, and hopefully continues to be from Capitol Hill as well, that it has to be about sustainability and those core services that hospitals and health systems provide in their communities. And again, we don't want to overlook that essential and need in the short term, in the now, while we're still working on parallel tracks, promoting innovation, across the healthcare field. But the rural communities can't and shouldn't miss out on that either.
Agree. Absolutely. Well said, my friend. Well said. More to come on that topic into the future, and would love to have you back on the podcast to discuss some of these initiatives that we've just discussed today and more. But as you reflect upon 2026 and you anticipate, what the future is going to bring, let's end with something positive. I mean, what excites you about opportunities that might lie ahead for us in 26? There is a lot of doom, there's a lot of gloom, there's a lot of uncertainty. But for you, Travis, in your very important role representing us throughout the country, what excites you? What do you think is going to be very important and a victory for you, even if we achieve a little bit of it?
Well, I think maybe I'll start just from a high level. At the end of the day, I do feel, as I said earlier, that rural health is one of the, unfortunately, maybe small number of areas where there's a lot of bipartisan consensus. So I'm hopeful, I'm positive. I'm a glasses half full guy. That I believe that there are opportunities, and I know there are legislators on both sides of the aisle, lawmakers of good faith who care deeply about access to care across the spectrum, but in particular focused on rural health care. And so, I mean, to me, I think that's the thing that gives me hope that, hey, there's going to be a way to figure out some opportunities in the coming months. It's an election year. There's not a lot of legislation that tends to get done in an election year. So I want to set expectations on that front. But at the same time, I think there can be, if not lots of legislation that gets done on this front, continued discussions and conversations that put us on a path, sometime in the future, even if it's not this Congress, to get momentum on key rural healthcare issues, whether that's child and maternal health, just more core rural access to care issues. I think there's a lot that can be done in that space, and I do feel like lawmakers on both sides of the aisle get the importance of access in rural communities and want to find a way to partner together on these issues.
Well said. It's been a great dialogue with Travis Robey, Vice President of Political Affairs at the American Hospital Association, someone who has been a fierce advocate, not just for healthcare, but for rural healthcare. And that's where my passion is, obviously, as well. If you're listening today and you do not belong to the American Hospital Association, for all of the things that Travis has just outlined for you that he's working on, that you yourself in the C-suite cannot get to, there's no way you're going to fly to Washington to deliberate on all of these matters. Make sure that you belong to the American Hospital Association. It is a sacrifice for rural hospitals like ours to belong to our associations and to pay those dues, but the value added and the return on our investment is 100-fold when they come through on issues as they have recently at defending and preserving 340B, ensuring that programs and projects that are allowing hospitals to remain viable and sustainable in their communities actually happen. It's because of the work that Travis and his team and the American Hospital Association are engaged in each and every day. So if you're listening today and you don't belong and you are the CEO, make the decision. If you're not the CEO, march to your CEO's office and say, we got to do something here. We need to join this team because they're doing a lot for us in Washington, and let your voice be heard. So Travis, thanks for joining us today on this episode. We do like to wrap up with a new segment that we have. It's called Rural Health Recommendations. And as a reminder to our listeners, every guest we have on the show, we ask them to contribute a recommendation on rural life and healthcare. And since you have experience in rural life, Travis, this might be a little easier for you than some of our guests. So it could be a tip for someone new to working in rural healthcare, or maybe some sage advice on thriving in a rural setting in today's very tumultuous environment. And then we'll add each recommendation to an online guide that will be available to our listeners on our website at ruralhealthtoday.com. So Travis, without further ado, what is your rural health recommendation for our audience?
Well, since I work in the advocacy space every day, I'll start with something there and then maybe give you something more rural specific. But as a former Capitol Hill staffer, I could tell you that there's no more powerful voice than the local hospital leader who can tell your story. So, please make sure that you do that. Obviously, we're here to tell that story on your behalf. Your state associations are here to tell the story on your behalf. But there's no voice that's more respected in your community than you are on these issues. So please continue to talk to your legislators, both at the federal level and the state level. When you tell your story, you also just make sure you're doing it through the perspective of how it's going to impact patients and the communities you serve. That's when your voice is most powerful, when you do it through the lens of the patients that you're focused on serving. So that's my recommendation. And then maybe secondly, just on rural, as somebody now who lives in Metro Washington, D.C., get out, enjoy the outdoors.
Yes.
Every time we get back and visit my mom and my in-laws, my wife is a Coldwater native as well. We always, my boys who are sort of city kids or at least suburbs kids, they love getting out, enjoying the outdoors, and that's what you've got at your disposal when you're in rural communities. Enjoy it, have fun, and take advantage of what's literally right outside your door.
Yeah, well said, my friend. Well said. There's something about nature and just connecting with the quietness. So definitely, if you're listening today, outside of the recommendation to get involved and to speak out, sometimes we just need a respite. We need to take some time away. And that happens in the great outdoors right here in Michigan and other places, but we're fond of Michigan. So thank you, Travis, for joining us today. It's been great to have your perspective. I do hope to catch up with you at the AHA Rural Conference if you're attending that, maybe to give us an update there, with a quick update on our podcast, if we can catch up there. But it's been great to have you on the podcast today.
Yeah, great, Jay. And I'll be in San Antonio, so look forward to seeing you and hopefully a lot of your listeners there.
Absolutely. And thank you to our listeners for tuning into Rural Health Today. Catch our next segment, Rural Health News, to stay up to date on our current state of rural health every Monday, wherever you get your podcasts. Don't forget to check out our latest updates and resources for Rural Health Today at ruralhealthtoday.com, and make sure you subscribe to the show so you never miss an episode. Until next time, remember the power of rural.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to our guests for sharing their expertise on the show, and also to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.